today's episode of The Daily Blend. I'm your host, AC, and we are joined in studio today by Dr. Laura Hesemann. She is a pediatric nephrologist at MU Healthcare.
That's right.
How are you?
I'm great. Thanks for having me.
Absolutely. It is so wonderful to have you here because I know you guys have something really exciting happening at MU Healthcare.
Oh my goodness, yes. So the brand new Children's Hospital is open. We have already moved into part of it. So the general pediatric floor where most of our patients stay and the pediatric ICU, both of those two units are open.
Wow.
We have fully moved in. We're using them every day, and that's the new home.
That's amazing.
Yes.
See, I didn't realize that they were already in and being used.
Yes.
That's amazing.
Yeah, moved in about a month ago.
Okay.
You know, it takes a minute when you move into a new house to figure out how you're going to live in it. And, you know, it's built beautifully and everything you need, but you have to figure out the flow.
You do.
Yeah, so it's been a big month, but really a positive change.
Oh, I imagine. And I imagine even more so when you're moving patients and equipment.
Oh, my
and,
gosh,
you know, staff.
Uh-huh.
I imagine it's even more trying to figure it out.
Yes. Oh, and move day was exciting. You know, we planned ourselves 2 full days to move.
Okay.
So that we didn't have to be rushed, so that we could do everything safely and do it the right way. And it was a big party. I mean, you know, there were ribbons across the front of every patient room. And so the patients who moved that day, who were already in the hospital, we had these kids cutting their own ribbons to move into their rooms. And, you know, gosh, it was fun.
I'll bet that was a fun, exciting time. Because I was thinking about the patients, you know, okay, we're going from here where maybe I've been to kind of a new, but to give them that piece, like they get to be a part of it.
Absolutely. Yeah.
The grand opening.
That's right. All the patients, I think, felt like celebrities. You know, they got the camera crew and their families and loved ones who were with them visiting in the hospital got to be part of, this is my room. You know, I'm the first one here. They felt so special.
Oh, I'm sure. It's like when you're the first one in a house, right? It feels pretty special. You're like, this is mine. This is the first, I'm the first one here.
That's
Nobody
right.
before me.
That's right.
That's exciting. So I know you have some divisions left to move over. What do you have coming up?
Yeah. So coming up in June, we'll be moving the neonatal intensive care unit, as well as the birthing center. So antepartum, labor and delivery, and postpartum. So we'll be moving moms and babies. That's, again, a move that we're planning to do over multiple days because we want it to not be rushed. You know, we have to pay attention to what's safe. Let's take as much time as we need to being safe and comfortable and doing it the right way.
Yeah, I can imagine so. So I'm thinking about, you know, that mom who's maybe close to her due date or will be close then, you know, and she's maybe sitting at home going, I wonder if I go into labor, am I going to be over here or over there?
Yep, that's right. So there will be lots and lots of communication. There already is a lot for a woman who is pregnant and planning, you know, we may be coming in around those days, which is June 10th through 12th, having a lot of conversations with their providers. Where do I go? What time? You know, if you're coming into labor and it's this day and this time, this is where you go. And of course, we have teams. If that woman, you know, it's kind of a hectic time when you're in labor. So maybe you forget and you go to the wrong place. We'll take care of it.
Oh, I bet. I imagine so. So tell me about the grand opening, kind of the public event that's happening.
Yeah. So we have a couple coming up soon. You know, the idea is for people to see the space, to see what we've been talking about, what we all have had in our minds and on paper and spent years planning and building and designing. We want the people of Mid-Missouri to see this hospital that was built really by them. And for them. You know, we want them to feel the energy. We want them to feel what it's like to walk into a space that was designed to take care of children and to take care of mothers. You know, this is not a hospital that's retrofitted to take care of kids. This is, we planned it this way.
It's built for that.
That's exactly right. Yeah. You know, I just think it's so important for the community to understand what this means, to see that commitment for, you know, we want kids to be taken care of. We want families to get the care that they need, the care that they deserve, close to home. They don't need to leave their community to get world-class care.
Yeah, it is that part for me. Like several years back, I had a friend who had to take her daughter to St. Louis. And that was a strain on the family.
Oh, yeah.
They're apart. One parent has to go, the other stays back with the kids. So that can be a bit of a strain on a family. So to be able to have this kind of care, this state-of-the-art building and care and doctors, for that matter, and nurses, right here in the community, that's really huge.
Absolutely. Absolutely. We want, like you said, to keep families together. Kids are healthier when they have a strong support around them. And that looks different for every family, what that support looks like. But like you said, people have jobs and they have siblings who also are living their lives. And healthcare shouldn't be the thing that overtakes a patient. It shouldn't overtake the family's whole life. It's a piece of it. And we want to be here to support that piece so that the rest of it also keeps going.
Yes, that makes perfect sense to me. And so that event that's open to the public is May
23rd.
May 23rd. And what's the time on that? Is it evening? I think it's evening.
Yes, starting at 5 o'clock.
At 5 o'clock.
Yeah.
Do we need to RSVP or can we just show up and say we're here to see?
Yeah. So there are a couple of different events. And I wish I had those dates right in front of me.
I'll bet people can find them.
All over the website for the clinical integration. And there will be a listing. There are actually several events. Some of those events do require invitation and RSVP.
Sure.
A lot of that has to do with, not about gatekeeping, but we're going to be taking people into this hospital and it's sort of crowd control.
Oh, I imagine.
So multiple different opportunities for folks to get in there and see.
That's amazing. Well, Laura, thank you so much for joining us.
Welcome.
And for letting us know about this new amazing facility that we have coming into this community. I'm very excited about it. And I'll definitely be popping over because I want to see it off the paper.
Great.
You know,
so much.
in person. I want to see it in person.
Yeah, it's fantastic.
I'm sure it is. Thank you for the work that you've done behind the scenes. I'm sure it's not been easy. And it's been a long time coming.
Yeah. It's a great thing to work on.